Hello, I'm Dr. Paul Chidester, the Chief Medical Officer for Monarch Medical Technologies, where we make EndoTool insulin dosing software. Today, I'm joined by Dr. Anthony Pick, who's an Assistant Professor of Endocrinology at Northwestern University. And we'll be discussing a recent guidebook that Monarch has produced, which summarizes the most recent 2024 Society for Critical Care Medicine guidelines for glycemic control. So, Dr. Pick, if you could just enlighten us with a brief overview of this guidebook that we've published.
The Society of Critical Medicine have come up with new guidelines. And I think it goes to this issue of we know that hypoglycemia and hypoglycemia both drive harm in critical care patients. So you have this nice piece that I've reviewed. And what I liked about it, because I'm expert, read the stuff, think about it, it's a nice summary. And it kind of highlights the importance and some of the nuances in that field.
And what would you say are some of the highlights that have been listed in those guidelines and that we've highlighted in our book?
It clearly delivers, number one, the threshold to intervene is 2 glucose above 180, which is a fairly common situation in critical illness. That's number one. It highlights the importance of controlling hyperglycemia while avoiding hypoglycemia. The third thing that it highlights, which obviously we're having a discussion with EndoTool, is that there's a drive from the professional societies and the expert review is the value of computer-assisted algorithms, differentiating EndoTool, for example, from paper protocols. So being able to do it in an effective and safe way in terms of a low risk of hypoglycemia. And then the fourth takeaway would be the operational issue about the burden on nursing staff and the burden on patients for the glucose monitoring, and making the point that the EndoTool is actually dynamic in that area.
So as we've discussed, there's a lot of valuable information in this ebook. And what would be your recommendation to readers to consider looking at this?
So when I read the ebook, I thought it was a really nice, well-done summary, easy to follow, and sort of, I'm always looking for things that add decision support. I thought it was actually helpful, not just for endocrinologists, who read this stuff every day, but for the critical care folks doing it, the critical nurses, the critical pharmacists. I thought it was a piece that was very accessible and very fair and balanced.